are back in our show, Good Morning Kuwait. We already see a glimpse about our report today, about our distinguished guest for heading for our second interview segment. Since establishment, the Healthy Cities Initiative, also WHO Regional Office and the Health Cities Office in Kuwait, coordinated a capacity building training workshop for the regional partner from the GCC countries, which was delivered online over 3 days on the 14th, 21st and also 28th of October 2021. The program already explored priorities in the context of the current health situation in GCC countries, sharing tools and also examples for the city, profiling and situations analysis also, Sarah.
Exactly. WHO Country Office partnered with a panel of experts from MOH, MOE and UN entities on a webinar aiming to build consensus on the mental health needs of children and teenagers as well ahead of school reopening, global statistics and evidence-based interventions guided with discussion shedding the light on the potential of technology-assisted teachers, training platforms, chatbots and games-based platforms to promote the uptake and skills of various students. To know more about that, we are so delighted to have with us today Dr. Assad Hafeez. He is WHO representative to the state of Kuwait. So hello and good morning, Dr. Assad.
Good morning, and it's always a pleasure to be here in the program with you.
You're most welcome, and thank you for joining us today in our show, Good Morning Kuwait. It's our privilege to be with us in the studio. We'll talk more about what's happening now during these kind of days in the state of Kuwait and also globally. Dr. Assad Hafeez, we're always happy, we talk to you about the COVID situations. So what we can say, where do we stand now with COVID?
Right, thank you very much. I think that's a very important question lingering on everybody's mind. And very recently, the Director General WHO, Dr. Tedros, in a statement mentioned that there is a possibility of seeing the end of pandemic in near future. However, still we're not there. And let me throw in a few facts for the audience to understand where we are. Till very lately, about 10 to 15,000 individuals are still dying of COVID every week. And millions of millions are either being infected or reinfected with this infection. About 1/3 of the population around the globe is not yet vaccinated, not even a single vaccine.
Still no.
Still not there. About 10 to 11 countries have their 10% of individuals, only 10% of individuals vaccinated. About 60 countries have less than 40% of vaccination. So with this sort of population still out there, which are non-vaccinated and prone to infection, there are still chances of re-emergence and surges and new variants of COVID.
Nice.
So it's moving, but we are still not there. One very important fact as well is that
which are
about 10 to 20% of individuals of the millions who are infected even now, they have post-COVID syndrome, lingering symptoms and very incapacitating symptoms at times for weeks and months. So this is, the situation. Though on one side we have some hope, but we have to tackle the existing situation in a very robust manner.
So this is like we call it the COVID situation all around the world, and our distinguished guest said like there is even a population, countries still not get vaccinated, and there is the infections already spreading also.
Exactly. So as you mentioned, doctor, there are like too many people, they haven't been vaccinated yet with all the mentions you mentioned actually. So are there going to be any more campaigns about COVID-19 vaccination?
Right. Let's focus now on Kuwait.
Yes.
We have luckily, and with the efforts of the government and other stakeholders, a better situation here with almost 85% of population vaccinated. So that's good. However, we should try to make it 100%, particularly the vulnerable groups, which are the aged population, the elderly, those with some sort of immunocompromise conditions and health workers. This group at least should have 100% vaccination. The global body which recommends the vaccination plan for all the vaccines including COVID has very recently suggested a second booster. So till now we had one booster, but now after this recommendation the second booster of vaccine is recommended, and particularly again for a group of people who are more vulnerable, and they are of course elderly, immunocompromised, pregnant women, all those who have some sort of comorbid condition, and I mentioned health workers. So anyone out of this group who has not been vaccinated with the second booster should get second booster. And after primary vaccination, and others who are the general population to whom 6 months or more have passed since the last vaccine, they should also be getting vaccination. But with passage of time, addressing your question of campaigns, it would be more prudent to integrate the COVID vaccine into the normal vaccination programs with life cycle approach, so that younger individuals, the children, the elderly, they get this vaccine through an integrated program rather than specific campaigns. Campaigns are not sustainable. So we're moving in that direction.
So this kind of directions, this kind of things is very important during these days and all around the world. Let's speak more about something new now, Dr. Assad. We are already privileged you are with us here. We are very happy. So we'll take information from you. So let's talk about the COVID situation during these days, about the development of the curious from COVID. There's any development happening during these days? We already people get vaccinated in Kuwait. You said more than 80% people get vaccinated, and you mentioned in the world there is some countries or population still not. What about the development of the cureness of the COVID-19 in the world?
There are some exciting developments. For example, there are trials of oral and nasal vaccines, which
oral and nasal vaccines.
So you take drops or you put something in your nose as a vaccine. So this would make the delivery of vaccines very, very appropriate. Moreover, newer vaccines, which the mainstay of the battle against COVID is vaccines. So development in vaccines is what is required. Newer vaccines which would cover all the variants is also on the cards. Also, there are about 4,000 plus clinical trials for various new medicines being tried out for the treatment of COVID. So WHO maintains a record or register of all such trials anywhere in the world. And as soon as a new development comes up which shows promising results, it is WHO's job to share this information with all member states, including Kuwait and all the health authorities. So we hope that in times to come, we would be much better equipped to deal with this kind of emergency and conditions in the future.
We all hope that, Dr. Assad, and as far as we know, there are several types of vaccinations. As I remember, Oxford, the one most common, and the other one was Aziz, I forgot.
Actually, Oxford and the other, I forgot the names. Too many.
There are now a number of vaccines, and many of them have been WHO pre-qualified. So if any vaccine reaches the standard of WHO pre-qualification, it is good for administration.
So what about the monkeypox? Actually, has been recently added to the vaccination list.
Yeah, thank you very much for bringing in this again another important threat, public health threat, which is emerging around the globe and which has been of concern. Monkeypox is a viral disease which is transmitted from animals to humans. So it is called a zoonotic disease. It comes up with symptoms like high fever, severe headache, muscle aches, weakness, and skin rash or skin lesions. So these are the typical features. it is transmitted from animal to humans, but also when human to human contact takes place, close contact, very close contact, then it is transmitted to other humans as well. So good thing about it is that if we can take appropriate precautions once monkeypox is diagnosed and avoid all close contact, it would not be transmitted. So that's one positive thing, and all the public health measures need to be put in place. Over the last weeks, the new cases, the emerging new cases have declined about 20% in last week. So that's a good sign. Again, coming to specific vaccine and treatment, there is no specific vaccine or treatment for monkeypox at the moment. Most of the cases are self-limiting. They take their time and go away. It is very similar to an earlier disease called smallpox.
Okay.
Which
smallpox? Is smallpox, though it has been eradicated from Earth by our efforts earlier, many decades ago. But some research which was done for smallpox and some products of vaccines and curables which were used to treat smallpox can also be used for this purpose, whereas research for new vaccine is underway. So though it's still a public health threat, there are cases not in Kuwait but around us, in Saudi Arabia, in UAE, in Bahrain. So it's a reason to be concerned, but not as great as it was in the times of COVID.
That's great, yes.
This is very amazing, and thank you so much for sharing the information about the monkeypox for the viewers and the smallpox also. It's something in your formation. Thank you. It's very affirmative. Now we're moving about the WHO itself, especially about the current activities, the current future agenda you are going to do here, because unless you are here in the state of Kuwait, what about the future agenda? I see some glimpse you are working with the UN also, and you have too many activities. So what about the future ones?
We are in the process currently of jointly developing the plans for next 4 years, which is called the Country Coordination Strategy. So Kuwait, the Government of Kuwait, Ministry of Health Kuwait, WHO, and other UN entities in Kuwait would jointly develop the priority areas for next 4 years, and then they would be divided into yearly activities. So that's the overarching plan. Now if you ask me that what are some of the priorities, of course for Kuwait it is the quality of care, which is in line with the national health vision of Kuwait. Also the non-communicable diseases, which is a major issue here, and their risk factors. Non-communicable diseases are hypertension, diabetes, and the risk factors which are common to all of these are physical activity, the type of nutrition, smoking. So all these need to be addressed in a very holistic manner. Another very important issue which is not only impacting the health of Kuwaitis but also others in the region is the impact of climate change on health.
The change of the climate.
Of course, yes, you know, the heat, the dust storms, and so many other things. You hear every day about the floods in country X, or, you know, some other extreme heat wave in country Y. So this is all because of climate change, and which impacts individual health. So it's important to measure and then to think of remedial measures for that, and we're working with the government of Kuwait to address this.
Thank you so much, Dr. Assad, for all your generous information and for refreshing the importance actually of COVID-19 vaccination and also the shedding the light of the monkeypox vaccine. So thank you so much, Doctor.
And thank you so much. For sure we will get with here again with to represent more about what's happening, the situation in the world. Thank you so much. So all thanks to Dr. Assad Hafeez, and he's a WHO representative to the state of Kuwait. Now, dear viewers, go to this tiny break, then we'll continue.